So this is a hard one. So you've had implants for a long time, your health has changed, and you want to know, are my implants causing all of my health problems? So since systemic symptoms from breast implants is a diagnosis of exclusion, we don't have any way to test for it. So a diagnosis of exclusion means that we have to rule out other things first that we can test for before we consider that this may be the problem. So your first stop is always your primary care doctor. You want to make sure that you've had all of the age-appropriate physical exam, lab tests, and cancer screening. That is the most important step if you're not feeling well. I can't tell you how many women have come to me for implant removals, never saw their primary doctor, and when I kicked them back to their primary doctor, we found really serious health problems that were easily managed and they felt so much better, and it was never the implants. So it's always important to have your primary care doctor as the first step. Now, say your primary care doctor has done all of those things already and everything is normal and they haven't found any reason for your symptoms. I think it's reasonable to consider removing your breast implants. So there's now been multiple studies in multiple countries that have shown that removing your implants alone will improve your symptoms in about 2/3 of women who believe their breast implants are causing their symptoms. So I think implant removal is a completely reasonable thing to do if you're not feeling well, have a variety of symptoms, and serious medical problems have been ruled out. So in the future, hopefully we'll figure out what exactly is going on with patients that are developing symptoms from their breast implants. And ideally, we would love to identify patients before they get their breast implants so that they never had to suffer any of these problems. But we're just not there yet. And I just also want to add that there are some people out there who will tell you that they can test for breast implant illness with the fancy tests that, of course, only they have at their office that are not verified or covered by insurance. And they'll also tell you they can treat your breast implant illness after implant removal with all types of detoxes, which are also not studied or verified. And I would be very careful giving your money to people like this. You deserve good evidence-based care like every patient with every other type of medical problem. Don't fall victim to these scams.